Hello everyone, welcome to my channel. Today we are going to solve few questions. So in case you did not subscribe to my channel and if you like my content, please do like, share and subscribe and let's begin. So the first question is, it's a case. So let's just go through it. A male is 70 years old and his chief complaint is his gums bleed when he brushes the teeth. And background and patient history states that blood sugar is 85 mg by deciliter and subcutaneous insulin injections is taken twice daily. Current findings is swollen gums and loss of stippling is there, bleeding on probing is there, general erythema and swollen and bulbous gingival margins are present. Okay. So what is the most likely diagnosis? So is it acute necrotizing ulcerative gingivitis, or is it chronic periodontitis, or it is localized aggressive periodontitis, or is it a gingival abscess, or is it gingivitis? So first read through the question properly and see what are the findings and how you can relate to that. So I don't think it is acute necrotizing ulcerative gingivitis, because in this case, in case of Anak, there's always a punched out crater-like lesion. Whereas in chronic periodontitis, it is over a long period of time where the patient might have halitosis, loss of attachment, along with all these symptoms. Now coming to localized aggressive periodontitis, it is a localized lesion. It is not mentioned anywhere. Now gingival abscess. So whenever there is an abscess, there is a swelling, there is an infection, so the patient's temperature might be high and radiographic findings will clearly state what's going on in that case, whereas nothing such is mentioned. Now coming to gingivitis, it is a generalized case where swollen gums, loss of stippling, bleeding on probing, general erythema, and bulbous gingival margins can be seen. So I would go with option E. So like I told you, the explanation is Anak is punched out ulcerations. Chronic periodontitis is swollen spongy gums, loss of stippling, bleeding on probing, redness, sponginess of the gum, halitosis, and loss of attachment. Now, localized aggressive periodontitis, destruction of bone will be more. Gingival abscess, definitely there will be a pus. And in gingivitis, there is swollen spongy gums, loss of stippling, bleeding on probing, redness and sponginess of the gums. So let's go with option E. This second question is the same case, the previous case. We found out that the patient has gingivitis. Now, how will you control it? What is the likely management and approach of the patient's condition? So will you go with scaling and root planing, or would you do a flap surgery on the patient? Would you administer the antibiotics, or would you do an antibiotic and chlorhexidine rinses? Scaling and root planing is the answer. Scaling and root planing should be done to remove plaque, calculus, and other irritants, whatever is causing the harm. Flap surgery is only indicated from moderate to severe periodontitis. In that case, it only said that the patient is having swollen gingiva and loss of stippling, bleeding on probing. So it doesn't indicate anywhere that the patient has moderate or severe periodontitis. We know that the patient is suffering with gingivitis, and for gingivitis, scaling and root planing is done. Now, only when there is abscess, so you get rid of the abscess, you incise it, drain it, and then you manage it with the help of antibiotics. So antibiotics administration are mostly used for management of abscess and in aggressive periodontitis. Antibiotics and chlorhexidine rinses are used in treatment of necrotizing ulcerative periodontitis, where you gently debride the tissue. Then you also make sure that the oral hygiene is improved, and you use Chlorhex or different kinds of mouth rinses. Now coming to, in which bone lesion there is alkaline phosphatase? Is it fibrous dysplasia, florid osseous dysplasia, or Paget's disease? Before you answer, let me tell you, there's other way, there can be a question where they say, are these diseases associated? Because radiographic examination shows that they are a little similar, but they are not associated with each other. Now, coming back to this question, do you think which bone lesion has elevated alkaline phosphatase? So the answer is Paget's disease. So what happens in Paget's disease is, before we go there, let me tell you something. There are two kinds of cells, osteoblast. Blast means forming cells and osteoclast means resorbing cells. So osteoblasts help in formation of the bone and osteoclasts help in resorption of the bone. When there is a problem, and what happens is there is excessive resorption and excessive bone growth. So suppose this part is osteoclasts have acted. Now, instead of just filling this portion, osteoblasts will fill such a huge portion. And this bone is not as strong as the original bone. All right, this is what happens in Paget's disease. Affected bone is enlarged and commonly deformed because of poor quality of bone formation. Excessive bone resorption will be there and excessive bone formation will be there. The patient will have curved spine and bowing of the legs can be seen, and enlargement of the skull can be seen, lion-like face can be seen, diastema can be seen. Diastema can be seen. Ill-fitting dentures are like, that is a problem which will be faced in these patients and because of this bone deformity. So this is the process which happens in Paget's disease. Now, there are three phases. Okay, one is early phase, intermediate phase, and late phase. So in the early phase, it is called as lytic phase. In intermediate phase, it is called as mixed phase, whereas in the late phase, it is called as sclerotic phase. So in the early phase, focal osteolytic lesions in the skull base are present that are asymptomatic. In mixed phase, you have both lytic and blastic lesions. Okay, so here you have osteolytic lesions that are asymptomatic. Here you have calvarial thickening, enlargement of the ridges, and hypercementosis of the teeth with or without ankylosis can be seen. In sclerotic phase, here is the stage where there is increased bone resorption. And in older textbooks, it's written that, like, you know, it looks like cotton wool appearance. Now, what is the diagnosis is, during the osteoblastic phases of the disease, there is high alkaline phosphatase. And in urine, patients have higher level of hydroxyproline. So this hydroxyproline is important because this is a marker for collagen degradation, means there is some discrepancy in this bone formation. So that's how you come to a conclusion that the patient is suffering with something abnormal, and that can be Paget's disease. And 25% of the patients have low levels of magnesium. So in the Paget's disease, you need to remember that osteoclast and osteoblast both are acting in a hyper state where there is excessive bone resorption and excessive growth. Patient's curve is like his spine is curved, there's bowing of legs, enlargement of skull, due to which there might be an ill-fitting dentures, and diastema can be seen. Three phases are present: lytic, mixed, and sclerotic phases. In lytic, you see focal osteolytic lesions, usually asymptomatic. In mixed is where you see like calvarial thickening with or without ankylosis. You can see hypercementosis of the teeth, and you can see enlargement of ridges. And in sclerotic phase, the bone resorption is uncontrollable. Diagnosis is alkaline phosphatase is present, it's elevated, hydroxyproline is elevated, and patients, 25% of the patients suffering with Paget's disease has lower levels of magnesium. Now, in case of odontogenic infection, incision and drainage is the first step, where a blunt dissection to break up the pus loculation is done. Which blade is used? Which blade do you think is used? Number 11 blade is used. So whenever there is an abscess, okay, so first you incise it with number 11 blade, and then you use a hemostat, okay, and then the beaks, what do? Is they break the abscess, like the small locules of pus is like, this whole thing is broken down into pieces with the help of beaks. And then what happens is, after it is broken, what do is you insert a drain. Okay, and that can be left for 2 to 5 days depending on how much amount of pus is present, and this whole thing is done in a hospital setting. All right, so answer to this question is number 11. So abscess is incised with number 11 blade. Beaks of the hemostat are inserted through incision and open so that beaks spread to break small loculations of pus that may exist in an abscess tissue. And then small drain is inserted to depths of abscess cavity. That drain can be left for 2 to 3 or 5 days depending on the severity. And this whole thing is done in a hospital setting. All right, so I hope you enjoyed solving these questions with me. And in case you have liked my video, please like, share, and subscribe. Thank you for watching.